It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Our next guest this afternoon is Dr. Cynthia Warner, a cardiologist from Providence Medical Group, talking about cardiology, breast cancer treatment, and heart disease today, and two very, very important topics, especially when it comes to women.
Absolutely, Tom. You know, with the treatment of breast cancer, sometimes the result is maybe some cardiology or cardiac problems or issues, and you want to have a cardiologist on your case with you.
All right, Dr. Warner and Shannon O'Kelly.
Dr. Warner, welcome back to Health Talk. How are you?
I'm doing well. Thanks for having me.
Well, thanks for joining us. The month of February, I love February, Valentine's Day, but it's also, more importantly, it's Heart Month. And, you know, in the month of February, we're talking about cardiology and heart conditions, etc. But also, February 7th was National Women's Heart Awareness Day. Mm-hmm. But I want to talk to you. Last time you came on, we talked about heart conditions in women. Mm-hmm. But, you know, women also have breast cancer, and breast cancer can cause some cardiac conditions or some things you as a cardiologist need to talk about or be concerned about. Mm-hmm. And particularly since you're at Providence up in Everett, Providence has a large breast cancer center there. Mm-hmm. I mean, probably one of the most fantastic ones in the state. Mm-hmm. And you probably deal with that a little bit. So let's talk about cardiac concerns and breast cancer treatment. How's that sound?
That sounds good.
All right.
So to underscore the importance and the prevalence of both disease processes, so about 48 million U.S. women live with cardiovascular disease, and about 3 million of U.S. women have or are breast cancer survivors. So important to understand the risks involved and treatment involved with both, especially now as breast cancer treatments have progressed and are leading to increasing numbers of survivors. There is a small but increased risk that some of the breast cancer treatments can contribute to cardiovascular effects. We tend to lump them in a term called cardio-toxicity, and that can have a wide range of definitions, but essentially what we're talking about are several classes of medicines that are used in the treatment of breast cancer that then can cause effects of what we say is cardiotoxicity. Now, that can range from anywhere from an asymptomatic decline in the overall heart function to clinical heart failure. That's the majority of what we're talking about. And those types of effects typically tend to come from certain types of breast cancer treatments, specifically the anthracyclines. Otherwise, an example of that would be doxorubicin, or otherwise known as adriamycin, and also in the class of families of HER2 receptor blockers, or an example of that, again, trastuzumab, otherwise known as Herceptin.
So these are drugs that are used to. Would it be fair to say these are chemo drugs, or I mean, would you call them chemo drugs? What would you call them?
So the anthracyclines or the doxorubicins fall into the chemotherapeutic, type of treatment. The HER2 receptor targeted treatment are more what we call immune-targeted therapy. So they target certain receptors that are noted to be positive in classifications of breast cancer, and that is their targeted treatment.
Yeah, because breast cancer, I mean, just understanding it, diagnosing it, and then treating it, the advancements are just spectacular. And like you said, the survival rates are phenomenal, and we need to keep working on the research and money, et cetera. But if are you going to get involved with the patient prior to treatment to get a baseline and then monitor this?
So there's an overwhelming movement towards getting multidisciplinary teams that are involved with cancer patients, specifically breast cancer patients that we're talking about today, to be involved with screening and monitoring, evaluating cardiovascular risk both before, during, and after treatments, based on certain risk factors and based on the certain treatment plans that are put in place will help to delineate risk, but then monitoring, again, setting a baseline before, and then monitoring throughout course of treatment, and then in most instances then after treatment as well too.
More with Dr. Cynthia Warner coming up right after this time out on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
We're continuing to talk about breast cancer treatment and heart disease with Dr. Cynthia Warner from Providence Medical Group. Here she is with Shannon O'Kelly.
Dr. Warner, again, thanks for joining us. You're doing a great job setting up potential heart problems with the treatment of breast cancer from the different types of medications. You talked about 2 different types of medications. Maybe you can dive down on that a little bit and talk about how you monitor that from a cardiology standpoint and maybe ultimate goal and results.
So from the 2 types of medication therapies that we talked about, in terms of Herceptin, they can cause a weakening of the heart muscle, variable in terms of incidence depending on your risk factors, but can be up to 8%, as well as development of congestive heart failure, which is less, but still a risk of up to about 3%. With the Herceptin types of treatments, the symptoms or cardiac events that tend to happen during active treatment, but most of them are temporary and reversible with either dosing adjustment or temporary cessation of treatment and initiation of cardiovascular agents. The other type of medicine that we talked about, or class of medicines, are the anthracyclines, such as the doxorubicin, otherwise known as adriamycin, and or its derivatives. And those can have similar types of effects on weakening of the heart muscle, ranging all the way to clinical heart failure. The overall presence of it, incidence, is about the same, a little bit less than the Herceptin. However, the effects can last longer and be more permanent. In either case, for both types of medications, really important, as we mentioned before, to get baseline and monitor heart function and overall heart health, both during and after treatment, and then creating a, like I said, multidisciplinary approach and plan to help catch these things early.
What would be some maybe early indicators or signs of maybe heart wall potential dysfunction that a patient should be aware of?
Part of the range of those cardiotoxic effects can be totally asymptomatic. So with your oncologist in forming a treatment plan, we look at your heart if you're going to be exposed to these cardiotoxic drugs before you even receive treatment, as well as during treatment, because your heart function can start to decline in the absence of any symptoms. Now, on the other side of that, if that goes on unchecked and uncorrected, then that can lead to clinical heart failure, which is the manifestation of the heart function not being working correctly or as efficiently. And that is with shortness of breath, fatigue, weakness, swelling in your legs, or a significant weight gain of approximately 5 pounds per day.
Wow. So as we wrap up here, summarize the concern that patients should keep an eye on.
Key points: evaluate before, during, and after the presence of cardiovascular risk factors, the optimization of cardiovascular disease, and then the preventing, monitoring, and screening for overall heart function.
Dr. Warner, again, thank you for your time.
Thanks for having me.
Once again, that's been Dr. Cynthia Warner, cardiologist from Providence Medical Group. Cardiology locations in Mill Creek and Everett. And you can go to providence.org to get more information on that. And it's certainly a topic that education is really important.
Education and awareness, is really important, particularly when you're talking about your heart.
All right, once again, you can get more information from her at providence.org. We'll be back with our final segment right after this time out on Como.